This one?
No, this one, the last one.
The last one.
Yeah. And
Give one layer. But you cannot point it here because it will not penetrate on the...
sure, it will just
Because that
only,
is an LED.
it's
Yeah.
LED.
Yeah, see? But it won't come out there.
How about
Yeah,
pointer?
you can use that one.
It will show in the presentation.
Yes.
Yeah.
It's okay.
It's a bit slow. Okay.
Yes.
Assalamu alaikum. Good morning, everybody. Thank you for inviting me to be among you today for this very important symposium and conference. And a special thanks to Dr.sheef for his excellent orchestration and work. I was asked to give a talk on the Saudi Clinical Practice Guidelines Initiatives. This is a journey that we initiated a couple of years ago. And before I start, I'm going to give this is my disclosure. And we started working in the field of VTE prevention across the kingdom back in 2001 and 2002. But the work was not organized under an umbrella of the body or society. It was until 2008, 2009 when we established the Saudi Association for Venous Thromboembolism. It's a subsidiary association under the Saudi Thoracic Society. Since then, we have done a couple of survey and research to look at the magnitude of the VTE in the Kingdom of Saudi Arabia. We have estimated that around 200,000 cases of VTE between symptomatic and asymptomatic develop annually, and 60,000 patients develop PE, and mortality rate annually between 15 to 20,000. If we depend on our clinical practice on the symptoms to make the diagnosis and treatment, we will only pick up 20% of the cases, and 80% goes unnoticed. The journey started back in 2010 when we met as a group, 3 or 4 of our executive members of the SAVITI. We met His Excellency Dr. Mohammed Al-Khushaim, the Deputy Minister of Ministry of Health, in 2010, and Dr. Fahad Al-Wahabi, the head of Sipahi at the Sipahi Headquarters Center in 2010. At that time, we highlighted the SAVITI mission and goals to both of the leaders in Ministry of Health, and that the initiative of SAVITI start or include the promotion of evidence-based practice of VTE prevention in the Kingdom of Saudi Arabia, to provide guidance for the diagnosis and management of VTE, and to reduce the variability in clinical practice among the healthcare workers. So our presentation was perceived positively by His Excellency and Dr. Fahad Al-Wahabi, and they asked to meet us a couple of months later to give us the proper plan of collaboration between the Ministry of Health and the SAVITI. After that, we met again in 2011, and His Excellency Dr. Khushaim said that since then he has met a couple of the societies and associations and looked at the prevention of common diseases in the kingdom. And instead of going and addressing these diseases individually, he thought to establish a center under the umbrella of Ministry of Health called the Saudi Center for Evidence-Based Healthcare, with the main goal of this center is to promote evidence-based practice across the kingdom, to provide guidance for the diagnosis, management of several common diseases, to reduce the variability in clinical practice and to collaborate with the medical societies and the associations. After that, the Saudi Ministry of Health, represented by the Evidence-Based Healthcare Center, contracted the McMaster University Working Group to provide the methodological support. This group was led by Holger Schoenmann. He is a professor and the chairman of the Medicine and Epidemiology Department at McMaster. And they have done a lot of work across the world in many countries. And at that time, they were recently coming back from Malaysia to establish an excellent work with them. Then the center contacted the SAVITI and other societies to nominate groups of clinicians from various specialties to address major or 10 major common diseases for prevention. The first meeting was held in Riyadh on December 2nd and 3rd, 2013. And this is a picture of the groups. You probably know a couple of the people there. And this is Dr. Zulfa Reyes. She is the head of the Evidence Health Care Center. And this is Professor Abdul Karim Al-Mu'min and other members at that time. They were like Prof. Uwaida, Tariq Uwaida, and Khalid Al-Salih, and Dr. Muhammad Sheef, and the rest of the members. During that meeting, on the first day, the panel received training on the grade system, which grade, recommendation, assessment, development, and evaluation system. On the second day, the McMaster group provided the panel with the pertinent literature, summary, and evidence to recommendation tables. The first wave of the meeting regarding to the VTE field was to establish the following Saudi clinical practice guideline. The first one on the DVT of the lower extremity diagnosis, then also the treatment of venous thromboembolism, outpatient versus inpatient management in collaboration with the Saudi Society of Hematology, and also the CBG in prevention and prophylaxis and treatment of VTE in cancer patient. If we take a brief highlight on the work of the first CBG DVT diagnosis, we will find that based on the literature review of the McMaster, the working group, that around 25,000 people are affected in Saudi Arabia annually, and 75,000 people are affected in the Arabian Peninsula, and almost 350,000 people affected in the Arab countries annually. Keep in mind that VTE is a diagnosis, most of the time is only picked up by the post-mortem, and almost three times of the diagnosed cases goes unnoticed until get picked up by the post-mortem. Not treating DVT may result in serious complications like post-thrombotic syndrome in up to 56%, PE in up to 32%, and death in up to 6% within a month. On the other hand, over-treating DVT may result in intracranial, gastrointestinal, and other hemorrhages that could be avoided. Therefore, it's very important to make the right diagnosis, and because if we depend only on the physical examination, that would not be sufficient, and in many of the time is not always accurate. Available diagnostic tests may lack also the sensitivity and or the specificity. Hence, an evidence-based diagnostic approach was crucial to develop to reduce the chance of not treating patient with DVT and also to reduce the chance of treating patient without DVT. The invited panel selected 24 clinical questions using a formal prioritization process for all the selected questions. The McMaster University group updated the related systematic reviews, conducted systematic search for information that were specific to the Saudi context, including searches for information about patient values, preference, cost, and resource use. So we took resource as very important part in our recommendations. The recommendations were based on the available evidence that reflected by sensitivity, specificity, negative and positive predictive values of diagnostic tests, and the implication of performing this test in patient outcome. The quality of evidence is graded according to the grade system as high, moderate, low, or very low. High represented by high confidence that the true effect lies close to that of effect estimate, and moderate is moderate confidence in the effect estimate and in that the true effect is likely to be close to the effect estimate, but there is a possibility it is substantially different, and so on. The panel also took in consideration the patient values and preferences related to the complications of both DVT and DVT treatment. Extrapolated mainly because we didn't have any evidence from that perspective in Saudi Arabia. Hence, it was extrapolated from the studies in US and Europe. Utility values range from 0 to 1. 0 is attributed to the death, while 1 represents perfect state of health. Also, resource diagnostic test availability and cost effectiveness taking in considerations. The recommendations were either strong or weak conditional. Strong, hence most patients would want the recommendation, and physician should provide the recommendation to most patients. And in the statement will be reflected as the Saudi expert panel recommends. The weak or conditional means that many patients may not accept the recommendation, and the physician must aid patient in making the decision, taking into consideration their values and preference. And in the statement, it will be reflected as the Saudi expert panel suggests. The first publication of the Saudi clinical practice guideline for diagnosis of first DVT thrombosis of the lower extremity was in January 2015 in the Annals of Thoracic Medicine. And this is the rest of the group, including the Holger Sherman. One quick highlight on the how do we do that. The question 1 in this guideline stated, in patient with a suspected first lower extremity DVT, should the choice of diagnostic test be guided by clinical assessment of pretest probability rather than by performing the same diagnostic test in all patients? If we look at the evidence, there was one large randomized controlled trials of almost 90% of the patients were outpatient, looked at the selected testing group of 860 versus a uniform testing for test for all the patients in 863. The selective testing is using the pretest probability assessment, Wells criteria, followed by diagnostic strategy. On the other hand, the uniform testing means that doing D-dimer for all patients. If negative, no more testing. If positive, ultrasound for all patients. The result shows that no difference in VTE incidence, no difference in major bleeding, no differences in death, and the selective testing reduced the proportion of patients who require D-dimer test by 22% and ultrasound by 8%. Therefore, you have to using the Wells criteria as a tool and will reduce the unnecessary test and cost for all the patient. And in our recommendation, we stated that the Saudi expert panel recommends the use of clinical strategy to assess the pretest probability based on Wells criteria compared to not using such strategy for the diagnosis of suspected first lower extremity DVT. Strong recommendation with moderate quality of evidence. And based on that, the question stratified, question from 2 to 8, based for patient with low pretest probability, and question from 9 to 16 for moderate pretest probability, and question 17 to 24 for high pretest probability. The Wells criteria, we make it in a table, simple. It can be put in a small piece of paper for all the trainee and ER physician, for also in the ER department, in the outpatient department, and you don't have to memorize them. Keeping in mind that minus 2 to 0 point means low probability with the DVT chance to occur in less than 5%, 1 to 2 points moderate probability with the DVT chance occurring up to 17%, and high probability DVT chance in 53%. Remarks, this CBG applies mainly to the ambulatory setting, outpatient or emergency department, and primarily targets primary care physician and specialists in internal medicine and emergency department. Keeping in mind also that no CBG can take into account all of the unique features of individual clinical cases, the recommendations are not dictate. Educational intervention may be needed to overcome potential expected initial resistance, and some recommendations may become quality indicators. The Saudi expert panel suggests local research on the values and preferences of the Saudi people, the burden of treatment with antithrombotic agent, and the cost effectiveness of the different strategies employed for DVT diagnosis. The second publication was just published also last year in August 2015 in the Saudi Medical Journal. And this, we addressed the Saudi clinical practice guidelines for the treatment of venous thromboembolism, outpatient versus inpatient, and a collaboration with the Saudi Hematology Society, and that represented by team leader Dr. Abdul Karim Al-Mu'min, Farj Al-Qahtani, Hazza Al-Zahrani, Khalid Al-Saleh, Muhammad Al-Sheef, which is one of the leaders in the King Fahad Medical City and the VTE prevention. We also published at the end of last year the prophylaxis and treatment of venous thromboembolism in patients with cancer, the Saudi clinical practice guidelines in the Annal of Saudi Medicine. This is also a collaborative work with the McMaster Evidence-Based Healthcare Center and Saudi Society of Hematology. We met again, the panel of the guidelines met again in Riyadh in March 15 to 18, 2015, by the meeting orchestrated by the Evidence Healthcare Center. In this second wave of the meeting, the plan was to develop the following clinical practice guideline: the CBG on prophylaxis of venous thromboembolism in medical and critically ill patient. We also addressed the prophylaxis of venous thromboembolism in long-distance travelers, and the Saudi clinical practice guideline for the prevention of VTE in surgically ill patient. The Saudi clinical practice guideline for the prophylaxis of VTE in medical and critically ill patient just published this month in the Saudi Medical Journal, and the other guidelines on prophylaxis of VTE and long-distance travelers, it is in press. It will be published this week, inshallah, and it is for the issue of January 2017. The last guidelines is the prevention of VTE in surgical patient and major orthopedic surgery. We haven't completed it yet, and Dr. Hassan Al-Jazri is taking the lead to write the manuscript for publication. So what is next after developing all these guidelines and the excellent work, or what we think it is an excellent work, among all the societies and led by the Evidence Healthcare Based Center under the umbrella of Ministry of Health and all the stakeholders and association involved in this guideline. So the steps after that is to disseminate these guidelines through presentations and education like in symposium and conferences, posting it in the Ministry of Health website, which is already available, all of it, posting it in SAVITY website, in our website, Saudi Association for Venous Thromboembolism. All the publications are available there. In the also Annal of Thoracic Medicine, Saudi Medical Journal, Annal Saudi Medicine Journal. Also has been reproduced in the application for smartphone, and it's available. You can download all of it. And after that, the hospital should take the steps to implement of this guideline. Another important step taken by Sibahi and led by Dr. Fahad al-Wahhabi, that they are reinforcing and implementing these guidelines in the all Ministry of Health hospitals and also the private hospitals. And after that, hopefully additional guidelines related to VTE prophylaxis and management. This is our website. It's savity.com, where all the guidelines can be downloaded. And with that, I would like to thank you. Thank you.